Yes, sir.
Hey, Judy.
For the last year or so, I've been having bad urinary tract infection going on my kidneys.
All right.
So I've been in the hospital to the doctors and everything, back and forth, antibiotics and stuff. So I went to a urologist in Fort Myers.
All right.
And he did biopsies on my bladder.
All right.
And said that I have ulcers on the left side of my bladder.
Okay, so you have a cystitis. Go on. All right.
So he said you can't do nothing about it. Now it's getting so bad when I cough, sometimes my bladder bleeds, and I pee like every 30 minutes at night. In the morning, it's every 10 minutes for about 3 hours. I'm in constant pain. They said they can't do nothing for me. What can I do? It's driving me crazy.
All right, well, first things first. Okay, Judy, have you had any weight loss?
I lost 20 pounds in about 6 weeks.
Okay, any cough or do you have any chills at night, like the middle of the night?
Well, before I go to bed, I've gotten real, like really sweaty and cold and stuff before I go to bed sometimes.
All right, well, there's some things that can cause ulcerations of the stomach of an infectious nature, okay? And they're not always what you think. Okay, so when somebody comes into my office and goes, oh, well, I've got this urinary tract infection, and then they have something that looks inflammatory, ulcer-esque in the bladder, I start thinking about things that can cause you to get really, really sick, okay? Because if you have a vesiculitis, no big deal, but could this be tuberculosis? Okay, TB of the bladder can present this way. Okay, so you'll end up with night sweats and weight loss. Okay, so getting a look up there, seeing an ulcer and not doing an AFB culture makes no sense to me. Okay, so Judy, what you need to do is call your family doc. Okay, and go, hey, listen, I've got this bladder infection. It doesn't look like it's just your basic gram-negative type infection, but can you screen me for AFBs? It stands for acid-fast bacillus or tuberculosis. You with me? TB is hitting a resurgence. It's coming back, and it's coming back to a medical community that's never seen it before. Okay, when I lived up in Baltimore, we used to see lots and lots of TB. And it came in all kinds of different ways. I had a lady one time that we were convinced that she had an ovarian mass. Why? Because she had a distended abdomen. She had all the regular stuff. When we opened her up looking for the mass, we were looking at an awful lot of TB that hit us in the face. Okay, so that would be what I would do because that's an important thing to rule out.
All right.